Welcome to Everything Mental Health with your hosts, Chris Weeks and Maureen Edwards.
Hi again, Chris.
Hi, Maureen.
So the first stage, or the first part of the cycle, of the addiction cycle, is considered the emotional or mental trigger.
Mm-hmm.
And so what is an emotional or mental trigger? That's usually a state. It could be a person gets into an argument with their boyfriend, girlfriend, or husband, wife. It could be they're dealing with anxiety and they don't know how to cope with it.
Right. So something maybe overwhelming, feelings of being overwhelmed by a situation.
Yes, it's an emotional trigger, and it can be anything. Many times it's relational, and that's just from observation and working with people for 30 years.
Right.
Many, many times it is in a relationship to another person. The person has a fight with somebody, there's an interaction with another person, usually a relative or a loved one, that they are having a difficult time coping with.
Right. So could it be as well stemming from? I would imagine that it stems from possibly a past traumatic experience, as well, in terms of how one is able to cope or deal with whatever circumstance is taking place.
That's interesting that you say that, because many times when a person doesn't have like a plethora of coping skills, they will default to the patterning and the ways that they coped from when they were a child.
Right.
And inadvertently, yes.
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 Right.
Definitely.
What about the circumstance where a person may be prescribed a medication, an opioid, for example, for an injury, and then develops an addiction as a result of wanting to continue to use that substance, in spite of the fact that let's say that the injury doesn't exist any longer, and so the person now is going through a sort of a stage of dependence on this substance.
Yes.
Can that also follow the same cycle in terms of starting with the emotional trigger and then moving on to the craving and so on?
I do believe it can. Now, I think that's a very interesting thing. I think it's important to note that most people that are prescribed medication or an opiate are not going to fall addicted to it.
Okay.
So I think it's important not to fear addiction. I think there's been it's something like only 10% of people who use substance or use alcohol will fall addicted to it.
Right.
So, but the people that do, or the people that have that higher tendency towards it, I don't have research to back this up, this is just my observation working with people for a long time, is that it does have to do with their coping mechanisms. And if they are getting some kind of physical pain relief, and in that physical pain relief, they also get like an emotional calming, because all of a sudden they're not dealing with all of these stresses or things that they have always had a hard time coping with. That can be very alluring. and on a subconscious level, of course. It's not really done on a conscious level. And then that can cause the person to want to continue. It's like, and then what happens is it's not just dependence, but there's a tolerance that increases,
Right.
so that you seek more and more just to get
Right.
the same effect.
Right.
So
Mhm.
yes. One other thing that I wanted to talk about is sometimes it isn't an emotional trigger, it's a psychological or a mental trigger. A lot of people can have compulsive or repetition in their thought patterns, or kind of like that OCD mind where it's
Mhm.
busy, busy, busy. It doesn't stop. It just keeps rotating, and what about this, and they keep going from thought to thought, racing thoughts, busy mind. And that can also be one of the mental triggers that can be part of that cycle of addiction, and that in that wanting to calm that, wanting to stop that racing or busy mind.
Right.
And we see that with ADHD, we see that with OCD, we see that from traumatic brain injury. There's many different things that can stem from.
Right. Very good.